With that, I'd like to move on to our next presentation. Our next presentation is on the subject of the adoption of the 2017 FDA Model Food Code. Here to present is Susan Shelton. Ms. Shelton is a public health advisor with the Washington State Department of Health Food Safety Program. She's been in the public health at state and local levels since the year 2000. Susan is currently the program lead for the retail food rule revision. She is here to talk to us today about Washington's recent adoption of the 2017 Food Code. Susan, the floor is yours.
Great, thank you, Brad. Good afternoon, Pacific Region. Thank you for the opportunity to present the highlights of our recent experience adopting the 2017 version of the FDA Food Code. We don't adopt the code by reference, and instead we use an administrative process to revise our rule. So in addition to using the Model Food Code as a basis, we also incorporate mandates from the legislature. And we just had a great session about the mandates from legislature and how they can adjust your food rule. We also take input from stakeholders, and then we incorporate lessons learned from outbreak investigations. Our food rule, called Chapter 246-215 of the Washington Administrative Code, is enforced by both state and local agencies, and it's used as a reference by many of our tribal partners in the state. We have a decentralized public health system in Washington, so we have a mix of local control and several state agencies that oversee retail food safety. The vast majority of food safety for the retail level in Washington is conducted by 35 of our local health jurisdictions. Each operate independent of the State Department of Health. And again, they're the primary regulators for restaurants, groceries, schools, mobile food units, markets, community events, county jails in our state. They're the ones, when they're getting questions about home prepared foods, they're probably the ones that are getting the questions primarily. You'll even have an opportunity if you for two later sessions to hear from two of our local health jurisdictions, King County and Clark County, later on this afternoon. We also, though, have several state agencies that have jurisdiction over retail food safety. We at the State Department of Health oversee the state ferry system, colleges, prisons, hospitals, and the majority of transient accommodations. We have two additional state agencies that oversee nursing homes, childcare, and similar institutions. And then finally, our State Department of Agriculture oversees wholesale food processors, but also includes two retail components. They oversee the cottage food laws that we have in our state, and also custom slaughter and processing. Both of those are exempted from our retail food rule. So again, my name is Susan Shelton. As Brad mentioned in my bio, I've been working in public health in Washington at the state and local level since 2000. Luckily, I also work with three others in the food safety program. Our program manager, Joe Graham, and our foodborne illness investigation lead, Janet Anderberg. We also have our third, which is an administrative assistant, Cindy Free. Hopefully you've gotten a chance to meet one of them over the years. Since we last verified Standard 8 that Chris mentioned earlier, we've actually lost two of our staff. So I have potential openings here in case you are attracted to come to Washington State. We also work directly with other programs at DOH that enforce our state rule or are active in food safety. So today I'll be highlighting our rule revision process, materials that we've developed, and 6 of the 27 substantial modifications that we made to the Federal Model Food Code. Feel free to reach out to me through the Pathable app or directly through my contact information if you want more. I'd like to start with a little bit of a brief history of our WAC 246-215 revision in our state. I'd like to begin at the top left in 1992. In the late 80s, Washington Department of Health actually separated from the much larger Department of Health and Human Services. Our 1992 retail food inspection rule was based on national recommendations, the Unicode, for those of you that have been in the service for quite a while, and also stakeholder input. 10 years later, in 2003, Governor Locke signed a state law for us to use the most current version of the FDA Model Food Code. This was generated by legislative action, and it was stemmed from stakeholder input, particularly from industry. They wanted to see us align a little bit better with other states, but then also inside of our state. Again, as I mentioned, we're local control, which can cause, maybe perception that we aren't using the same code, but ultimately we all use the same code in the state of Washington. So in 2003, we were directed to start using the federal model as our basis. So this revision that we just completed, actually we're still kind of close to getting it effective, is our third adoption of the Model Food Code. And again, we're moving from the 2009 version, which we adopted in 2013. to the current 2017 version of the food code with the supplement. For this revision, we started the process in July of 2018, and we did it by sharing a comparison of FDA's 2017 version with our current state code. So we had all of the items where we diverged from the federal model, and we shared that with stakeholders. From that process, we received about 100 comments during an informal comment period, and then we presented those and the differences between our state rule and the food code to our standing statewide Food Safety Advisory Council for proposed changes. I'll mention the Food Safety Advisory Council, which I'll shorten to FSAC often today, because again, that is our key body that we use to run and ask questions of and provide comment and really work on the rule revision. Our FSAC has 14 members that represent stakeholders affected by WAC 246-215. Those include academia, consumers, local health, mobile foods, temporary foods, institutions, schools, and a few others. After about 7 months of regular meetings that were between 4 and 6 hours long with the FSAC, we were prepared to make a first draft. So we created that and shared it publicly in May of 2019. After we shared it, we held public, sector-specific, and online presentations. We also tried to explain the draft rule to as many people as we possibly could so that we could get another round of comments before we prepared our second and closer to final draft. So again, that was toward the end of the fall of 2019, and that we worked again with the Food Safety Advisory Council and 2 additional meetings, and then prepared the final language. Naturally, the end of 2019 transferring into 2020, we were, our initial timeline had designed us to actually start to get to rule implementation at that point. But because of COVID, we had quite a few changes to the timeline. And our official hearing was moved from early 2020 to late in fall. And then we extended all of our comment periods and other periods for people to actually provide comment. Obviously, it was a heavy lift for a lot of our stakeholders to help us review and provide comment on the rule during the COVID-19 response. So while we were originally shooting when we first started in 2018 for implementation in 2020, we also did follow a delayed approach requested by industry partners. And so we have 3 effective dates for our revised rule. One section became effective in January of this year. We had several sections in our revised rule that were needed to be updated because they were in conflict with current state laws. So again, we hadn't adopted a new rule since 2013, and we had several state law changes that we needed to incorporate. So our first effective date was January of this year, and it only included the changes that were legislatively mandated. Our next one is the main effective date, and that's March of next year. So March of 2022, that's when the remainder of the changes become effective. And then the third delay is we have an additional 1-year delay for the requirement of the Certified Food Protection Manager. So we have multiple documents and materials that we prepared throughout the process, but I'd like to highlight 6 that were the skeleton for the revision details that we shared with stakeholders. Each of these is available on our website, which is mentioned here in the title of the slide. So we provided a tracked changes version throughout each of the drafts so that stakeholders could view the inclusions as well as the deletions in each of the versions that we had. Because the track changes were over 100 pages, those documents were very lengthy. Also, it was kind of difficult to read because, again, it highlighted each of the changes. We also provided a summary of each of the modifications so that stakeholders could review them, and they were organized by the different parts inside of the rule. We also shared a top 10 document of the key changes that also provided updates to advertise our public presentations, our website, comment periods, and timelines. Many of our industry and local health partners use this information to provide periodic updates to their stakeholders as well. And then, of course, as required by state law, we prepared a significant analysis of the rule. The SA details the general goals and specific objectives of the state law and explains why it's needed. It analyzes alternatives to rulemaking and any consequences we would have if we didn't adopt the rule. It determines the probable benefits of the rule and whether or not they're greater than the probable costs. It also considers the burden and deviation from federal laws. So we had 27 provisions inside of our rule revision that warranted analysis. And again, later on in the session, I will be covering 6 of those in the presentation. Also, after the State Board of Health adopted the final language, we also had quite a few comments that were presented to the State Board of Health. And so they asked us to incorporate those comments into the final version. So we prepared the concise explanatory statement. Again, it's a requirement under state law to identify the changes to the rule that were made due to the official comments. So in addition to the staggered effective dates, which was implemented, we had 3 key changes to the proposed rule. We have a legislative mandate in our rule to allow for freshly made rice noodles to be able to be transported from a production facility directly to a food establishment at ambient temperatures. So that was a legislative rule. Well, we also provided some additional language that they could be either immediately served or they had to be immediately hot held or cold held or cooled down. So we provided a little bit of additional language there based on comment. We also had quite a bit of comment about the food code section related to businesses needing to provide a notice to consumers that they can view their inspection report. And so we received comment to say that that should either be it could be a summary of the inspection report, or it can be whatever that the regulatory authority provided. And so we provided a little bit of language change there after we presented to the State Board of Health. And then our final one was related to, we provided some changes for allowance of pet dogs in outdoor environments. And we drafted that based on language that we saw from other states and municipalities. And one of the key components was that we required the area to be signed. And we received comment back during the official comment period to the State Board of Health that they requested and had rationale for us to remove the signage requirement. And so that was another modification that we made. So again, the CES, the concise explanatory statements, really going to explain and detail the comments that we received, both pros and cons, and then our reaction to each of those comments during the official comment period. And then finally, we also prepare and share a printable draft copy of the food rule. So that has all of the changes. It's a little bit more reader friendly and it includes all the edits incorporated. And then we used colored fonts to actually identify the change language. So I like to show that to you so you can kind of see what I'm talking about. All of our state rules are called chapters. And so we make a terminology change in our food rule. And so we call all the chapters that you see in the food code, we call them parts in Washington state. So chapter 1 in the food code is called part in our WAC. We include each of the chapters from the food code and have added a 9th part for specific facilities. And inside that part 9, we include language for mobile food units, bed and breakfast, temporary food booths, donated food, and preschools. So again, it goes above and beyond. Sometimes it gives additional requirements. Sometimes it gives additional leeway for those types of facilities. We try to maintain as much connection as we possibly could to the federal model. And for each of our provisions that are based on the federal model, we've included inside the title of our section, the actual food code provision number as well. And that way, if somebody wants to look up what our code is based on, they can actually look in the federal food code, and they can also use the annex as a resource. Our official numbering convention is WAC 246, 215 hyphen, and then we follow it with a 5-digit section number. Throughout our reader-friendly version, you'll see that we shorten and just use the 5-digit section number to make it a little bit easier to communicate. And you'll also notice that our section numbers do not match what you'll see in the food code, which is why it's really important to actually look at the title if you're trying to compare our rule to what's in the federal model. We also do not use the priority foundation or core mentions throughout the code. We have converted those in Washington state to either what we call red high risk factors or blue low risk factors. And so things that you'll see as general core items, we'll probably consider that a blue, and then the priority and priority risk will probably, or priority foundation will probably be what we consider a red in our state. So that was another major change that we made. And then due again to our staggered effective dates due to COVID, we've included red fonts for the language that became effective in January, and we included blue font for language that became effective, that will become effective in March of next year. So once the rule does become effective, we will remove all of these text highlights and just provide the final version in black and white. And then finally, one of the most used portion of our readable version is the index. And it's similar to the food code. We provide a listing of the key terms and where to find the related section by page number. However, what's unique is we also include the section number for the terms to help the reader find the proper reference when they actually do go to that page number. And then you'll see that we also carry the red, blue colors in the index for the changed elements during this revision. And that'll help hopefully people as well as they review the code, they can go, okay, this was a change, and I'll look it up and make sure I'm working on it. Okay, so we also, though, those documents are shown on our website. These are not. These are a little bit more designed just for back of house use. And we developed 2 additional materials for our programs use that might be of help to you in your process. And we definitely don't intend to include these on our public facing website. The first spreadsheet shown here in green is a listing of the FDA food code provisions starting in 1993. And including up to the 2017 supplement. And it includes and tracks the provisions from when they were first introduced in the food code, and then as their language changed throughout the years. We also included the CFP issue history and language from the FDA responses with the provisions to help us identify rationale for the changes where we could. And so it stemmed from our need to make sure we were considering the food code fully as our stakeholders were suggesting changes to the model food code. You know, sometimes we had comments from individuals that were like, well, wait a second, that was also presented to the CFP, and here's the rationale for why they didn't want to make this change or why they did make this change as is. So we really tried to be as solid as we could and really wanted to understand a lot of the history and intent that went into the food code. So agreeing that, again, that first spreadsheet there that's in green is really designed to be able to evaluate each of the code provisions. And then it's obviously sortable. You can sort it based on CFP year, you can sort it based on FDA food code edition, you can sort it based on provision, quite a few different ways that you can sort that. So it's really user-friendly, but again, it was really designed for us for back of house. The second spreadsheet, which is shown here in blue, we created to list each of the provisions in the food code inspection report marking instructions in Guide 3B of Annex 7. So as you know, a lot of us use the food code CFP model for our inspection report form. And I think a lot of us probably have made modifications to it. And so we detailed each provision that was cited on the marking instructions on a spreadsheet so that we could then align it with the items that we had in our retail food inspection report. Again, we use this spreadsheet to help draft our marking instructions and also try to make sure that we were aligning with the FDA as much as we could. We have quite a few differences in our inspection report form. We definitely modeled it on the CFP, but we have combined some of the provisions. We've added a few that are specific to Washington. And so, for example, for those of you that have seen the newest, where you'll see that the food code includes language specific for the cleanup of vomiting diarrhea plans, and they have a couple of others that are very line item specific. We've incorporated that in different sections in our inspection report form. So again, this spreadsheet was really helpful for us to be able to go, okay, let's be able to make sure we've got each of these provisions reflected on our inspection report form. Now, I really want to emphasize, this whole seminar has been awesome to try to, make sure we're all working on standards and the importance of them. And I just really want to make it clear that Washington tries to meet standard 1. We are not even close to meeting standard 1. We just completed our self-assessment and we are meeting 5 of the 11 primary factors, the required risk factors. So again, it's a constant effort for us, but we also really do use and implement both a substantial stakeholder input plus a very active legislature. And as we were just mentioning in the last session, our state law also allows retail sale of raw milk. And we also broaden allowance for some home prepared foods. So again, it's a constant effort for us, but I'd like to cover 6 of the modifications that pretty much did keep us from meeting the standard, but also did reflect what we could do in our state to still meet food safety, to still meet public health, and to implement some of the modifications from the current version of the food code. Our first one is the Certified Food Protection Manager. So again, we were operating and still are on the 2009 version of the FDA food code, which considers the Certified Food Protection Manager as meeting the demonstration of knowledge requirement. We really have not required the training or the certification in our state. We do require a separate, what's called the Washington State Food Worker Card for all employees. So we do have a training requirement, but it's not specific for managers. When we presented this to our Food Safety Advisory Council and our stakeholders, they were really concerned about a few issues. In particular, we have a lot of languages that are spoken in Washington State, but there aren't that many languages that are available for the certification. Also, there's concern about the cost of training and the certification, especially if it was required per shift. And then there was also concern about maintaining a certified food protection manager due to all the staff turnover. So ultimately, the Food Safety Advisory Council provided numerous modifications in the proposed or in our rule to reach consensus. And we did ultimately reach consensus on this one, but you'll see why we have quite a few changes. So we're going to allow any person designated as an employee. So that was a big change. We're not saying it has to be a person in charge. It's an employee, which could be somebody that is a contractor. It could be somebody that just has, that works with the business, doesn't necessarily mean that they're one of the managers. So it's allowing maybe one person can have multiple. So a business or a certified food protection manager can actually be a CFPM for multiple locations with our rule. We allow a 60-day grace period to replace an outgoing CFPM. And then we also, as I mentioned earlier, allow a 1-year delay of enforcement of the provision. One of the key ways, though, that we did this and try to address, that we were ratcheting this back closer to the 2013 version, we added in the concept of active managerial control to our rule. So we included a definition of active managerial control and then explicitly required it as a duty of the person in charge. And so that's how we tried to augment these changes that we made to the certified food protection manager requirement. We also incorporated date marking. So date marking has brought considerable discretion to the Food Safety Advisory Council. And though it's been in the federal model since 1993, we have never adopted it in Washington State until this version. Historically, our stakeholders have had concerns that this is an onerous provision for both industry and regulators, and with few lab confirmed cases. And so we really wanted to make sure that we were really focused on the public health risks of listeria. And so the way that we're rolling out with date marking is we're going to include date marking for all foods, just traditionally that all foods need to be date marked, but as what we consider a blue item. So they're going to be not one of our high risk items that require immediate control and potential discard. We're going to focus instead on the foods that are considered high risk for Listeria monocytogenes for potential immediate correction and discard in our reds. And those are the food items that are identified on FDA, CDC, and USDA's risk assessment for Listeria monocytogenes. And so those are soft cheeses, deli meats, milk products, some of the smoked fish, other key items that are identified as either high or just very high risk for Listeria monocytogenes. And we've agreed with industry that we will maintain a list of the cheeses that are exempt, and we'll continue to add to it as we identify other exempt cheeses. Again, really working on this one and trying to focus the effort on foods that are going to potentially cause the most illnesses in our state. This one's one of my favorites. This was our #1 comment generator in Washington State, and it was refilling reusables. So as you know, the food code allows an establishment to refill reusable clean containers. They can be done at a food processing center. It can be a beverage that's non-TCS. We have quite a few options in the model food code, but Washington went above and beyond. We provided a modification to the federal model. So we would allow a consumer-owned multi-use beverage container to be refilled with a drink, including TCS. So the food code is specific to non-TCS foods, but we would include it with TCS as long as it's contamination-free. But here's where we really started to diverge. Under an approved written plan, we allow quite a few additional options. And we have where businesses can opt in and prepare, a written plan and accept consumer-owned containers to be refilled based on their capacity. So they might have consumers that can fill containers with non-ready-to-eat foods, but they can also potentially go all the way up to allowing employees to refill a consumer's container with any food. So while we agree that the provision needs substantial guidance and education, we believe this provision, as an opt-in this case, and only when approved, will allow for each business to consider their available capacity when drafting their plan to prevent contamination of the bulk food supplies. And again, we had a lot of comment on this, and a lot of people wanted us to make this a requirement that business had to do this. And so we were really working on both the consumer, but then the business and regulator approach to this one. This was a huge change in our state. And again, we modeled it on several that are in other municipalities. Not a lot of states have exempted quite a bit or allowed for additional refillables, but again, this is going to be probably a big one for our state. Also, we had some modification to allowing pet dogs. So you'll remember this is in the section on prohibiting animals in the food code, but we received comments for allowing pet dogs in outdoor areas. And so we worked on that with the Food Safety Advisory Council, and we incorporated language from Arizona and other states. However, during the rule revision process in the last session of the legislature, they actually changed state law to allow dogs in microbreweries. So we also incorporated language to allow for it in all of our similar food establishments that have very minimal food prep. And you'll see here on this chart, we have requirements for approved plans, a notification to the local health, a limited menu. Obviously, we say that it can't be in prep areas. They have to be confined or leashed. They can't be on furniture, no employee contact. So we have quite a bit of language in here in our code related to it. And then again, as I mentioned at the beginning, we did have a comment to strike the customer signage. And that came from a national coffee chain that was like, man, this would cost us a lot of money to provide all the signage. And like, we already allow it for service animals and other dogs. So again, the State Board of Health concurred. And so we did remove that requirement for signage. And I just mentioned too, as a highlight that I skipped one. So I wanted to mention that we had quite a few petitions during our process to get rid of this prohibition of bare hand contact. And so when we worked with our stakeholders on this, we're like, we can provide better education because, we want to make sure people are controlling the risks. And so they agreed. And so we were really working on providing approved plans and additional materials. So we have quite a bit of language that we developed to actually support people understanding what the requirements are for bare hand contact with ready-to-eat food, the allowances, and then things that they can do to actually get evaluated to see if they have employee health and hygiene and active managerial control to the point that they can actually have bare hand contact. I don't know if it's going to be as much of an issue now after COVID, because again, people I think are pretty hyper vigilant on touch and spread through contact. So we'll see how that one goes. But again, that's how we address the petitions that we receive for bare hand contact with ready-to-eat food. And then I do want to mention, we also modified that new FDA section related to workers handling ready-to-eat food items as they're adding it to the cooking vessel. We did modify to say it doesn't have to be when they're adding it to the cooking vessel. It just has to be for foods that they're going to actually cook before they're served. So before they leave the facility. And then I want to mention and end on one very specific for the Northwest, and that is about our parasite destruction. So just give me 1 second, please. I see that the slides are going a little bit fast. So our sixth modification that I want to talk about today, fresh caught finfish. And so in our state, they're often served undercooked, even though the consumer advisory isn't designed for parasite reduction. And so big in our state is fresh halibut, fresh off the boat, fresh salmon, and those do not go through a parasite destruction, which is all well and good, except they're traditionally ordered undercooked. So we really feel like this was a risk for consumers that wasn't declared. So we modified our code to require or to allow partially cooked finfish upon consumer's request, and only with a modification of the consumer advisory. And this modification of the consumer advisory, we aren't going to require that to be printed on the menu, that they can request a separate document, because the modification is going to have to include the concept of parasites. And our industry in particular, and then we concurred because they're like, we don't want to put the word parasite on our menu. So again, we're going to allow the option that's in the federal model to have a separate document that people can review. So again, we think this is going to highlight the potential risk, since it is a practice that's done pretty repeatedly, probably in multiple states, but definitely in the Pacific Northwest. And then again, we have quite a few guidance materials. I only brushed over 6 of the changes that we've implemented. And so, we worked really hard to get to consensus. We didn't always get consensus. We got plurality. So for those items, we're going to really work with our Food Safety Advisory Council to develop guidance materials to increase consistent application. We're also working on several, and many of these are in tandem with the AFDO and FDA grants. So we will publicly share these as well with all of the materials that we're developing. And then so my final recommendation for you and from your friends here in our program, when you start your rule adoption process, really encourage you to be ready for the trip. One of the things that we identified is that the current rule and the revision process is not going to be widely understood by stakeholders, and we're going to find some consistency gaps. And we kept identifying them throughout our entire process. So be ready to explain your current rule and the revision process to stakeholders. Check out with your friends. Several states have recently gone through the revision process, and we encourage you to reach out to your retail specialist or industry associations as well when your rule is revised. Really do learn from the lessons from others. We also encourage you to put your details on paper, maintain written timelines, and development, file management, and planning are crucial for this multi-year project. We have multiple partners, updates. We had multiple delays. We had a lot going on. And so having things in writing is really going to help you. And then finally, adopting the rule using a stakeholder process, especially, is very time and resource intensive. But the work overlaps with multiple program standards. Really want to end this presentation with a thank you to AFDO and FDA, which assisted many of our products and projects during this rule revision. They provided grants. The FDA in particular provided a lot of input. We asked a lot of questions about the provisions in the food code. So really encourage you to reach out and get support. And I really also want to mention a sincere thank you to our retail food specialist, which is David Ingalls-Kirchen. He was incredibly helpful during our Food Safety Advisory Council meetings throughout our entire rule revision process. He's been a perfect resource for us and a very active partner in our rule revision and just in general with our application and understanding of the food code. So thank you, David. I know you're in the room. And then finally, I want to thank you for attending. Again, you can reach out to us through our Foods website. You can also reach out to me directly. I'll connect you with somebody if you want to speak to anybody. We've had a lot of stakeholders involved with this rule revision process. I'm the one that gets a lot of the either blame or glory, but again, I can connect you with others. And then you can also subscribe if you're interested to our retail food code stakeholder government gov delivery listserv. And again, I thank you for all your time.
Thank you so much, Susan. That was a tremendous presentation. I do have some questions that have come in, and I'm going to kind of go backwards with them. They came about kind of along the direction of your presentation. So were people concerned about the waste generated from the use of gloves for the no bare hand contact?
Yeah, it was a combination. So that was a big industry angle, was like, it's the consumable waste and then obviously we have a lot of legislation about waste and solid waste in our bills. And so that's going to affect industry all over. And so we definitely try to get people to use reusables, right? Use a utensil, use a tongue, use a fork, do something else, change your process. There are times that they have to use a barrier such as gloves. So yes, that was one of their key concepts. But again, we address that by saying there are a lot of different things that you can do that you don't have to use a consumable. And so that's one of the documents. And the document I showed on the slide was, here's how to reduce the demand on your gloves. And so again, that's going to be our change that we're going to have, is to sit there and go, let's change a little bit on how we do this. Another thing that we heard, and I don't want to cut into everybody's break. I know you have I can also answer through chat, but we also heard quite a bit about the application, maybe regulators were requiring things that didn't really, or that was the understanding from industry. They're like, they tell us we have to use gloves and tongs with this. And so we're trying to make sure that we have a consistent message as well. But I will tell you, we were very happy that industry, the people that presented the petitions were like, okay, no, we agree that this could be an option that we will try to get to work. We're avid believers in, using barrier with ready-to-eat foods in Washington.
Next question is related to date marking. Did you include non-TCS foods in the date marking requirement?
No. We definitely didn't expand the ones you had to do. I can guarantee you.
Yeah. Will you have these spreadsheets that you shared available for might be?
Yeah, I wish we would have had those when we started this. We developed them along the way. And another one that we did, but it's really not as polished as those other two, which are still back of house, is we went through other state codes because we wanted to know what are other states doing for this, especially for the ones that we modified. So, you know, our section on certified food protection manager, on the marking instruct, on the date marking, on quite a few provisions, we're like, what are other states doing? So we evaluated each of those for the other states to go, yeah, we're in alignment with this one. They've also gone through this process. And so again, that one is really specific for the modifications that we made so that we could figure out what other states are doing. So we have a third one actually, and we will share them. We're trying to finalize our last year report. We had a 3-year grant. Thank you, FDA and AFDO, for a lot of this work. And so we are trying to wrap that up, and we'll have it all ready, and we'll share it with the Resource Center on Food Shield.
Okay, great. Thanks
with you directly too.
What is Washington's reason for not using priority foundation and core?
Yeah, so that's a historical concept, and we've just always separated ours into red and blue. And so they align very closely with priority foundation and then core. But again, some things that we kick in. So I'll give you an example. We consider a presence of and use of a thermometer as a red, right? And traditionally that's not going to be at the higher risk inside of the FDA model code. And so that's one of the areas where we diverge a little bit. And so we have some that we're like, we're going to elevate this. We're going to consider this a red. And then others, we like the date marking now, that's going to be a blue for us. And we recognize that's a priority for FDA. We're getting there. We're working, but
sure.
Trying to get it to work.
Next one, do grocery retailers, are they exempted from the indoor dog policy?
No, so it's not that they're exempted from it. It's their opt-in, right? Our code doesn't say you have to allow it. It just says, hey, if you're going to allow this, this is what you need to do. So no, every food establishment would potentially have that access. The only thing about grocery, the vast majority of them do more food prep than what is actually allowed, right? So that's really more designed. That'd be like more like a grocery that just has refrigerated product and people pick it up and it's containerized. It wouldn't affect many groceries because they're like, no, you have way more food production than what would be allowed for indoor dogs. Pet dogs, I should say.
Let me check with David. David, did you have any other questions that came through on your end?
Brad, I don't see any other questions. So if you don't see any and I don't see any, I think we can move on.
With that, thank you, Susan. I know you were a switch hitter for us and gave 2 presentations during the seminar. We greatly appreciated that. So thank you.
And I want to give you guys a props. This has been great. Thank you.
Thank you. And with that, won't keep you from break. We'll throw you to David Engelskirchen.